hypothermia, moderate and severe. Mild where you have 36 degrees Celsius to 36.4. Okay, and moderate from 32 to 36, and severe means less than 32. Child may die, sometime, because of hypothermia also. Okay, and why hypothermia is common in infants? Because large surface area of babies are, uh, baby has large surface area as compared to their weight, and they have limited heat generation mechanism, and they have decreased subcutaneous fat and brown fat. So subcutaneous fat and brown fat, is it acts as a, it helps to preserve the heat inside the body. Okay, subcutaneous fat and brown fat. So they don't have that. It's in very minimal amount, and they have poorer homeostatic response to hypothermia and early exhaustion of metabolic store like glucose. They don't. Because they have large surface area one, and the heat generation mechanism is not good. They don't have sufficient subcutaneous fat, and they have very poor homeostatic response to hypothermia, and they get exhausted, and their metabolic store gets depleted soon, so that they don't have this homeostatic response is not so good. They don't have. I hope you know what is this. Okay, I don't have to explain this. Homeostatic, that means. And methods of temperature. See, in children, in infants, you can measure the temperature in on the axilla, or in the rectal. You can you have a particular thermometer. You can insert it inside the rectum and you can measure, and by just touching the skin also you can find out the whether the temperature is raised or not in case of infants. Okay, like you can touch the abdomen, feet and hands. Okay, at the back side of your hand, and if it's warm, it's normal. If temperature is raised, you can make it out. Okay, obviously you can't say how much degrees Celsius, but in remote areas you can make it out. Okay, and so prevention of hypothermia, I will not go through this. Okay, so kangaroo mother care also, I will not go through this. This will be taught to you in the. Okay, why this kangaroo mother care is here? Because it is there in the um flowchart. Anyways, I'll talk about the flowchart first, and I will so first you have to keep the young infant warm in that case. Okay, if when you find out that baby is having hypothermia, you have to provide private to the mother, and you have to advise her to initiate to give kangaroo mother care. That means giving skin you are transmitting heat of the mother to the baby through her skin, so there will be skin to skin contact, and that's how you're going to raise the temperature of the baby. So are you familiar with this term kangaroo mother care? So for this, you have to what you have to do is ask the mother or father to sit or recline comfortably. They have to sit properly. Then they have to undress the baby gently, except the cap, nappy, and socks. And you have to place the baby prone on mother's chest. I think this. Okay, this is the same thing. Request the mother to sit comfortably, undress the baby gently, and place the baby prone on mother's chest in upright and extended pose. It's called frog position between the breast of the mother. Okay, in this way the baby should be facing the mother's face. Okay, and then in skin to skin contact, so that their skin to skin can come in contact. Okay, a baby's skin come contact with the mother's skin, and turn baby's head to one side to keep airway clear, and cover the baby with mother's gown, and then after that you have to wrap the baby and mother from the outside. Okay, with blanket or shawl, and if possible warm the room more than 25 degrees Celsius with a heat device. So with heater or AC you have to turn on, and you have to make sure that the room is warm, the temperature is more than 25 degrees Celsius. That's the optimum temperature for the baby. Okay, so in labor room and in the pediatric ward also, they try to maintain this temperature 25 degrees Celsius. Okay, so this is called kangaroo mother care because you know kangaroo also carries their baby in the pouch that is present in their body. Okay, so that's why it's called kangaroo mother care. So okay, so it's the most practical preferred method of warming a hypothermic infant in a primary healthcare facility. So in NMC, KMC, you have various devices, like there's baby cot where they have special baby cots which will keep the baby warm. Okay, we have ACs, we have heater, we can maintain room temperature. But in remote areas, especially in primary healthcare facility, we don't have all these facilities. So this technique is very much in use. Okay, that is called kangaroo mother care. So it was this is basically for low birth weight babies. So low birth weight babies, their surface fat is very very minimal. Okay, they're very lean and thin, and they're very small, so they can't generate the heat on their own. That's why they die because of that. Okay, low birth weight baby along with the hypothermia. That's why in Colombia in 1979, Dr. Hector Martinez and Edgar Ray, they were the one who introduced this method. Okay, beside that you have to make sure that the delivery room, everything should be warm and neat and clean. Okay, and the baby should be breastfeeded um, every 90 to 120 minutes during the kangaroo mother care. Okay, and then what and you have to make sure that baby is gaining 40 gram per day. Okay, for the consecutive 5 days, then only you can discharge the baby. Okay, so just for the nappy change and breastfeeding, you can take out the baby. Okay, otherwise you just have to keep in contact with the mother, skin to skin contact, and you have to wrap up the mother and baby do with the extra blanket and shawl. Okay, that's how you have to you increase the temperature of the baby. And after every 1 hour you have to reassess the baby and look, listen and feel for signs of possible serious bacterial infection, and measure axillary temperature by placing the thermometer in the axilla for 5 minutes. It's not here. I have not written this. Okay, so reassess after every 1 hour. You have to check the baby's temperature. You have to see whether there is any signs of possible serious bacterial infection. And axillary temperature you have to measure. And if signs present or temperature still below 36 degrees Celsius, then you have to refer urgently to the higher center after giving pre-referral treatment. That is one bolus of antibiotic, and making sure that the baby is not hypoglycemic. Okay, so counsel the mother for home care. If the baby starts gaining, the baby's temperature comes back to normal, then you have to send the baby home. And before that, you have to advise mother properly, regarding their food and fluids, like how much to give whenever, you don't have to, you can't give three measure meals like adults. In case of babies, you have to feed them frequently, minimum 8 to 12 feeds per day. Okay, and for as long as the baby wants, and make sure the young infant stays warm at all times. It's not like now the baby is fine, and after going back home you can just expose the baby, or so you have to make sure that the mother is well counseled. Okay, like how to keep the young infants warm and how often to feed. So follow-up visit chart is also there, and looking at this, they ask the medical persons, they ask the parents to come back for follow-up visits, like for all like jaundice, ARI, diarrhea, bacterial infection within 2 days, because we have to assess them, reassess the baby, whether they are improving or not. Okay, if not, then they have to again refer them to higher center. And for low weight for age, it's for after 14 days only. We give enough time to gain weight. Okay, and along with that, we also advise mother when to return immediately. Okay, if the young infant has any of these signs given below, just rush back to the primary healthcare center. That's what they have to be told, during discharge. Like breastfeeding, when the baby is not breastfeeding or drinking poorly, becomes sicker, develops a fever or feels cold to touch, starts bleeding fast, having difficulty in breathing, and baby starts developing this yellow discoloration on the palms and soles, and diarrhea with blood in stool is seen, then rush back to the health center. Okay, otherwise they will not know. They will just they will not check. They will not be that much. They will not be alert. Okay, so they will not take care of the baby, like whether they are bleeding fast or not. So it becomes very late when they reach the by the time they reach the healthcare center. So they had the mother or the parents have to be told about these things. Okay, and along with that, as I told you, IMCI also take care of the mother. So if the mother is sick, provide care for her or refer her for help. Advise her to eat well, to keep up her own strength and health. Make sure she has access to contraceptives and counseling on STD and HIV prevention. So all these aspects has to be taken care of. Okay, why contraceptives? Because there needs to be good gap between two kids. Okay, and whether they are eating properly or not. Okay, whether she is fine or not. Okay, whether she needs any kind of treatment, that should be taken care of, because if the mother is not well, then obviously she can't take care of the baby. So it's in our part, it's mother who plays active role in taking care of the babies. Okay, fathers, they basically go outside and earn, and it's mainly the mothers. Though that she works outside, it's basically the mother who takes care. In some cases, if both the parents, you know take care, but mostly it's mother. So here you just we talk about the mother, not father. Okay, so after this we'll move to the sick child. So above 2 months and below 5 years, that is up to 59 months. So it's ARI and diarrhea is quite similar, but the management is slightly different. Okay, not much, slightly. So let's talk about the sick child aged 2 months to 5 years. So I was talking about the 59 months under 5 years, but here they have given the flow chart up to 5 years. Okay, don't get confused. Yes, under 5 children means 59 months, but this flow chart is for 60 months. Okay, for 60 months baby also. So again, name of the child is weight, temperature, child's problems, initial or follow-up visits will be asked. Then we have to assess for the general danger sign, which is whether the child is not able to drink or breastfeed, whether the child is vomiting everything, or child has had convulsions during this illness period, whether the child is lethargic or unconscious. So these 4 points should be assessed first and foremost. And after that, if this is present, then we have to give the pre-referral treatment and rush the baby to the higher center. Okay, so but wait, after danger sign you have to assess these also. Okay, but obviously if the danger sign is present along with this symptom, then you have to refer anyway. So then we have to check for these common problems, which is common in this age group. Okay, so we'll talk about it one by one. Air problems, very very common: fever, diarrhea, ARI. Okay, so first of all, you have to ask like if whether the child is having cough or difficulty in breathing, and if the mother said yes, then your next question will be for how long. Okay, and the mother will say for 2 days, 3 days, 4 days, whatever. After that, you have to look, listen, and feel for. First, you have to look for the breaths. Okay, like you have to count the breaths of the baby in 1 minute. You can't count. I mean, you can't count the breath sound for 22nd and multiply by 4, like in case of adults. So in ICM, they must have done it. I don't know whether we have done it or not, but basically what we do is, for adults we don't count the breath sound for for whole 1 minute. We just count it for 20 seconds and multiply it by 4. But in case of newborns, infants, you can't do so, because sometimes they breathe faster, sometimes it becomes slow, sometimes it takes, and in between they pause for a second. So you have to be patient and count for a whole 1 minute. Okay, so here, what is a normal bed count then? So for here I have missed out for less than 2 months. For less than 2 months is 60. Okay, for 60. But here, since we are talking about from 2 months above, so I've taken this. So 2 months to 12 months, the breath count should be 50. 50 breaths per minute. If it is more than 50, or equals to 50, it is passed. Sorry, it should be less than 50. Okay, up to 49 it's okay, but if it is 50, and if it is more than 50, like 55, 60, for babies from 2 months to 12 months old, then the baby is having fast breathing. If you are looking after 12 months to 5 years old children, then it should be less than 40 breaths per minute. If it is equals to or more than 40, then the child is having fast breathing. Okay. So then next will be, you have to look for the chest in drawing, and then to look and listen for the strider. So yesterday no, on Sunday I think I took your class. So for young infants, there was grunting. I told you that it's a sound you produce during inspiration or during expiration. But grunting is basically the noisy breathing the young infants produces while breathing, okay, because of the problem in the breathing. But this strider is present in the child 2 months to 5 years old children. Strider could be inspiratory or expiratory, mostly expiratory. Okay, so inspiratory if there is obstruction of airflow above glottis. Okay, at glottis, supraglottis or subglottis, if there is obstruction of the airflow, then what happens when the air enters the air passes, when it causes turbulence. Okay, and they produce a stridor, inspiratory stridor. This is high pitched abnormal breath sound that you hear without using any stethoscope. Just from outside you can hear it. Okay, and if the obstruction is at the trachea, near the trachea, then the uh, abnormal sound is stridor will be heard during expiration. So this is at trachea expiration, at glottis, supraglottis or subglottis during inspiration. So uh, uh, I mean, the sound you will hear the stridor, this which is a monotonous high pitched sound, which will be heard will depend on the area where the obstruction is. Okay, so okay, the test in drawing I told you how you have to look for test in drawing. While breathing in, our whole chest moves out. But in case of the breathing problem child, the lower chest moves inside. It sucks in, goes inside. Okay, because they have to work extra hard to inhale the blood, inhale the oxygen inside the chest. Okay, then now let's see if the child has any general danger sign, or the child is having chest indrawing or stridor in calm child. That is, the child is having danger sign and the child is having chest indrawing or stridor. Then you have to classify the baby as having severe pneumonia or very severe disease. So both you have to write. Okay, this is the classification for the child showing all these signs: severe pneumonia or very severe disease. It could be severe pneumonia or it could be very severe disease. So what you have to do is give first dose of antibiotic. Here you give the drug of choice is chloramphenicol injection. Okay, injectable. Or if there is no injection chloramphenicol available at the health center at the time, then you can give amoxicillin capsule or one capsule. Okay, then refer urgently to the hospital. Okay, and if the child is having fast breathing only, okay, then the classification will be pneumonia, and in that case you have to give oral antibiotic. Cotrimoxazole is the drug of choice. Then you have to soothe the throat and relieve the cough with a safe remedy like cough syrup. Okay, and then advise mother when to return immediately. like you have to tell her the then the signs and all. Okay, then you have to ask her to come back within 2 days. And if there's no signs of pneumonia or a very severe disease and the child is only having cough, sorry, then your classification will be no pneumonia, semicolon, cough or cold. It could be cough or cold. Okay, so if coughing more than 30 days, then you have to refer for assessment. Okay, just can't leave the child saying that the child is having only cough. You have to make sure that the child cough gets relieved. Okay, before 30 days. And then you have to soothe the throat and relieve the cough with a safe remedy. Safe remedy means in cough syrup, some like strepsils and all. Advise mother when to return immediately and follow up in 5 days if not cured. Okay, then so next symptom that you have to ask for is diarrhea. So here, this is the child with dehydration. You see, sunken eyes. Okay, lips is also dry and looking very lethargic. So in case of diarrhea, also you have to ask the parents, does the child have diarrhea? If the answer is yes, then if the answer is no, then you don't have to ask all these things. Okay, just ask another symptom, like like whether child has jaundice or anemia. You have to go for that. So if the answer comes yes, then your next question will be, for how long is the blood in the stool, because you want to rule out dysentery. And then you have to look for the lethargic or unconsciousness in the child, whether the child is restless or irritable. You know why we are looking about this condition, general condition, because we want to see whether the child is having dehydration or not. Okay, and you have to look for the sunken eyes, and you have to offer the fluid to the child, and you have to see how the child is drinking it. Okay, whether the child is able to drink the water or not. Okay, fluid, whatever, ORS we can offer, or the child is drinking poorly, drinking but very little, by very little amount, they're just taking sips and not showing so much of interest, or they are drinking eagerly, drinking and they want more, or they are very, very thirsty, they are gulping, they are taking they are drinking very quickly. So you have to look at these points. Okay, and skin turgor is what you have to see, and you have to see whether the skin is going back very slowly, that is more than 2 seconds or not. I have already discussed about this. So then if two of the following signs are present, then the child is having severe dehydration. This is the same like before, but here there are four signs are included, whereas in case of young infants only 3 signs were included. You're not able to drink or drinking poorly is also added. Okay, so if the baby could not drink or is drinking poorly, then severe dehydration. Here this treatment is also quite similar with the young infants. Like if the child has no other severe classification for severe dehydration, follow WHO recommended treatment plan C, that is giving IV fluid. Okay, 100 ml per kg. Okay, and once the baby is stable, if the baby once the baby can drink, then start ORS. So if the child has another severe classification also, then you have to refer the child urgently to hospital with mother giving frequent sips of ORS on the way, and this is the same thing. Okay, and if child is 2 years or older and there is cholera in your area, you have to give antibiotic, 1 dose of antibiotic for cholera also. Okay, before referring. Then if two of the following signs are present, like restless, irritable, sunken eyes, drinks eagerly. See, everything here, the first general condition is lethargic or unconscious for severe dehydration, okay, and not able to drink or drinking poorly, and skin pinch goes by very slowly. Your sunken eyes is same, but no, now the child is only restless or irritated. The child is crying, and if you touch the child is, very irritable, okay, and drinks eagerly and thirsty. See, when someone becomes severely dehydrated, the person will not the person will not be thirsty anymore. Okay, but if the dehydration is present to some extent, then child will be thirsty. The child will show that they want to drink more. Okay, if you see sunken eyes and skin pins going back very slowly, lethargic, but baby is not drinking, you can't say that there's no dehydration. Okay, that's the opposite. The child is very much dehydrated. So, and skin thins goes back slowly, not very but slowly. So some dehydration. So here also, if there is no other severe classification, follow plan B treatment. If yes, then send the baby urgently to other hospital. Okay, and advise mother when to return immediately. This is for this. After giving plan B, that is giving ORS within 4 hours quickly, then reassessing and continuing the ORS. Advise mother when to return immediately and follow up within 5 days if not improving. With this advice you send if you are giving plan B. If not, if the child has another severe classification along with the some dehydration, then you refer urgently to other hospital. And not enough signs to classify as some are severe dehydration. Yes, the child is having passing stool, okay, but there is no other signs suggesting suggesting dehydration. Then your classification will be non dehydration, and you have to give plan A. Plan A means giving ORS and homemade fluids, okay, and advise mother when to return immediately and follow up in 5 days if not improving. So with this advice, you send the baby back home. So after that, if the child is having severe persistent diarrhea, then you have to treat dehydration before referral unless the child has another severe classification. So you have to treat dehydration and then you refer the child to the other hospital. And if there is persistent diarrhea but no dehydration, this is for severe persistent diarrhea with dehydration. But if there is persistent diarrhea, so persistent diarrhea means if the child is having diarrhea for more than 14 days. So if there is no dehydration, advise the mother on feeding a child who has persistent diarrhea, give single dose of vitamin A, give zinc sulfate 20 mg daily for 14 days. Okay, and send them home and ask them to follow up after 5 days. Okay, and if there is blood in the stool, that is dysentery, treat for 5 days with cotrimoxazole and follow up in 2 days. So this I have already discussed. So the only difference here is you give 30 ml per kg in infants. We give 30 ml per kg in first hour, and fever is persistent and present every day for more than 7 days, refer for assessment to the hospital. So they don't do much for the fever. Okay. So if the child presents with fever and rashes like this, okay, then what happens? You have to suspect measles. So you have to look for the signs like any general danger sign or clouding of cornea. Cornea becomes white, okay, turns into white color, and or deep or extensive mouth ulcers present. Then it need to classify as severe complicated measles because clouding of cornea and mouth ulcers, they are the complications of measles. In that case, you have to give a dose of vitamin A, a dose of injection chloramphenicol, and for clouding of cornea or post draining from the eye, you have to give tetracycline eye ointment. After that, this is pre-referral treatment. After that, you have to urgently refer to hospital. You can't do much here in the primary healthcare center. And if pus is draining from the eye and mouth ulcer, but there's no any general danger sign, then you have to classify as measles with eye or mouth complications. And again, you have to give vitamin A, and you have to treat the pus draining from the eye. Okay, there is eye infection. If there is pus draining from the eye, there is eye infection due to measles. So you have to give tetracycline eye ointment. And for mouth ulcers, you have to give the gentian boil it, and you have to send them home and call them after 2 months, 2 days for follow up. And if the measles now or in last 3 months, there's no any complaints, then obviously, fever only. If the child presents with fever plus rash plus runny noses, classify as measles and give vitamin A only. That's it. And if there is air problem, which is quite common in the children, so if yes, you have to ask if there is air pain or if there is any discharge from the air and for how long. Okay, the pain and discharge indicates air infection. Okay, so you have to look and look for the pus draining from the air. If the mother says the child has air discharge, you have to look at the, you have to do the local examination whether pus is draining at the air or not, and you have to feel for the tender swelling behind the ear. because it could be mastocytitis. Okay, that's very common in the children. So if there's tender swelling behind the ear, we had your classification will be mastocytitis, and you have to give the one dose of injection chloramphenicol, one dose of paracetamol, because obviously they'll have fever also because of the inflammation, and you have to go urgently to the hospital. If there is passes, if you could see the pus is draining from the air and it is reported for less than 14 days, or simply there is air pain, then your classification will be acute air infection. There is no tender swelling behind the ear, only pus and acute air infection. Give antibiotic cotrimoxazole for 5 days. Give paracetamol and dry the air by wicking. Means you have to clean the air. You have to mother to take the soft cotton, and you have to clean it up. Okay, and then you have to dry the air. You have to do wicking, that is called wicking, and then follow up in 5 days. If pus is draining from the air and discharge is for 14 days or more, if it is less than 14 days, it's acute. If it is 14 days or more, it's chronic. Okay, you don't have to give antibiotic here in case of chronic. Just try the air by wicking and follow up in 5 days. And if there is no ear pain and no pus draining from the air, then no ear infection and no treatment required. So after this major problem, let's talk about the malnutrition and anemia. Wait, where is the malarial treatment? Chart is what I have to talk about. I have not prepared separately. Okay, so here, okay, so high malaria risk, like if no, I've already discussed about it. This okay. This is for no malaria risk area. Okay, if there is no history of travel to malaria risk area or no malaria risk area, but if the child resides in high malaria risk, then you have to um, okay, please follow this chart. Okay, so if there is any general and there's a sign stiff neck or bulging fund, if there is malaria, give oral malaria risk area. If the child is in high risk district, you have to start anti-malarial drug. Okay, after making blood smear, and then give paracetamol and then refer. Okay, no. Once mother went to return immediately, follow up in 2 days if fever persists. If fever for more than 7 days, then refer for assessment. But you have to give the anti-malaria drug. And if any in low malaria risk also, any general danger sign or stiff neck or bulging fontanelle, then very severe febrile disease will be classification. Here also you have to give the first dose of IM quinine after making a blood smear, and then you have to give the IM or IV chloramphenicol, and then you have to treat for the low blood sugar and give one dose of paracetamol. Don't follow this, just follow this chart. Okay, this has been taken from your park book. So give one I don't know why that slide. Okay, so see, if you are treating with a fever and if you're suspecting malaria, you have to give the anti-malaria. Here also you have to give the IM quinine. And malaria, if the child presents with fever, but there is no stiff neck or bulging fontanelle, and no runny nose, no measles, and no other cause of fever, only you have to suspect malaria, and that is for low malaria risk zone. Okay, and you have to give anti-malaria drug after making blood smear, and everything is same. You have to give paracetamol, and you have to send them home and call them and ask them to follow up within 2 days. And if fever present every day for more than 7 days, refer for assessment to the hospital. And if there is runny nose and there is no fever but runny nose and or measles present or other cause of fever present, then malaria unlikely. There is fever but malaria unlikely, so give one dose of paracetamol and advise mother when to return immediately and follow up within 2 days if fever persists. And if fever more than process for more than 7 days, refer for assessment. This is how you have to do it. Okay, fever with rashes I have already discussed what to do. Air problem also done. Then for malnutrition and anemia, you have to check for the malnutrition and anemia. How will you check? You have to look for the visible severe wasting. Okay, you have to see the weight of the child, height of the child, and you have to see whether the child is wasted or not. And then you have to look for the palm or pallor, whether the pallor is severe, or there is some pallor, palmar pallor present. Whether it's severe or very low, okay, you have to look for it. And then you have to look for the edema of both feet, and then you have to determine the weight for it. So wasting is low weight for A's, so you have to calculate that. Okay, and then you have to classify the nutrition status. So this is a child with anemia. See, you have to compare the hand with your own, and you can see this is the palmar pallor is present. Okay, this is severe here. So if there is visible severe wasting or severe palmar pallor present, or edema in swelling of the both feet, or then the classification will be severe malnutrition or severe anemia. Then you have to give 1 dose of vitamin A, and you have to make sure that you prevent low blood sugar in the child, and then refer urgently to hospital and keep the child warm on the way to hospital. But if there is no waste, what is this? Some pallor is there, but there is no edema, but very low weight for age is there. Okay, very low weight for age. The child looks very small for this. Then anemia or very low weights. Then you have to assess and count feeding. So you have to see if there is any feeding problem. Okay, and you have to counsel them. Then if there is feeding problem, you have to counsel them how to feed, when to feed, and follow up in 5 days. If pallor is present, give iron, folic acid for 14 days. Advise mother when to return immediately. If pallor present, you have to follow up in 14 days, and if very low weight for age, then you have to follow up in 30 days accordingly. Okay, if pallor plus so very low weight for age is present, then 14 days. If not, only pallor present within 14 days. If only low weight for age is present, a follow up in 30 days. And not very low weight for age and no other signs of malnutrition, no palmar pallor is present, then your classification will be no anemia, not very low weight. And if child is less than 2 years old, assess the feeding and counsel the mother on the feeding problem. We have already discussed. Just for in case of young infants, we have to counsel. And if feeding problem is present, follow up within 5 days. Advise mother when to return immediately, and give prophylactic iron, folic acid if the child is uh, 6 months or older. Okay, prophylactic. If the child is 6 months or to and have to immunization states. You have to check out for the immunizations as national immunization program. I hope you are aware of the national immunization program. If not, then at birth we give BCG, and this is the let ball. At birth, BCG is given 6 first dose. Pentavalent includes hepatitis B and diphtheria, pertussis, tetanus. Months, MR first dose and PCV third dose is given, and in 15 months, MR second dose is given, and in 12 months, JE is given. That is our complete immunization schedule, and you should know before assessing the immunization status of the child. And how to check the immunization status? If an infant has not received any immunization, then obviously you have to give all the vaccine. Okay, and then you have to give follow-up care. So you have to call them back, and you have to assess the child whether they have improved or not. Okay, if they have not improved, you have to refer them to the hospital for the reassessment. So this is how the follow-up vegetable looks like. Okay, for this you have to when to follow up. It's given clearly in the chart, so you just have to look at it and you have to tell them, see, this is how the IMCI format looks like. The name is, weight you have to record here. Okay, this is for your sick young infant. Okay, and you have to, for possible bacterial infection, questions to be asked, and you have to, whatever you have to look, you have to, everything is given here. Okay, this is how they have to follow. Okay, and treatment, this should be written, and when to return we have to mention here, and give any immunization needed today, that's also should be taken care of. This is for the sick child, the idea and all. Okay, so this is how it is, all charts they have to fill up. Obviously there is, you have to ask, and treatment is given in the flow chart. You just have to write it here like prescription. Okay, so this is all. Now what's the time? It's 4. So what should I do? There is a video. I have a meeting at 4:30. Okay, online meeting. So it takes half an hour. So what should I do? Should we postpone it for tomorrow? Hmm? Related to IMCI. Is there any question?